absolutely is art, and that's the thing that separates what I think is a good hair transplant from a great hair transplant, you know? So what we typically do is to try to find a hairline height that's appropriate for our patient. Most physicians will generally start at around 7.5 centimeters above the eyebrow, and that will work for the vast majority of patients. However, the other thing that's really important is to look at the temporal peaks and see if they've receded. If they have, then it's necessary for you to go ahead and increase the height of the hairline so that everything looks proportional. So generally we start at about 7.5 centimeters, and then I go ahead and curve it over on both sides to the frontotemporal angles. And we know where it's supposed to meet because you can draw a line typically starting at the anterior point of the ear and then following it right up, and it intersects so perfectly. I know surgeons who technically do great work. I mean, every follicle is just robust and excellent, but if you go ahead and give somebody a straight hairline, then you're not going to achieve a natural, really, imperceptible appearance. That's what we're trying to go for. One of the things that I tell all patients is my goal is to try to make you look as natural as possible, and once the results manifest, the goal will be for people to look at you and be like, you look great, what happened? I don't want anybody coming up to you and being like, oh, did you get one of those famous hair transplants? That's not typically what we're going for. This will help keep the hairline looking as natural as possible. Oftentimes what we see is that surgeons will go ahead and just create a straight across hairline, and look, that might be okay for some folks, but for my patients, I want them to have the best, most natural looking hairlines. The other thing that's really important about designing a hairline is to not be tempted by the existing stray hairs that are in place. As you can see here, we have a few finer hairs that are miniaturized. I'm not going to allow that to dictate what hairline I'm designing. I can use that as an inspiration, but ultimately, if we sit here and try to recreate the hairline that he had when he was maybe in his 20s, it's going to start to look really unnatural when he starts to get into his 50s and 60s, and it's very important for me to make sure that this hairline is as timeless as possible. It's really nice when patients do have these little stray hairs below the existing hairline, because it will ensure that the transition from scalp to hairline is very soft. You don't want to go straight from skin into a very dense hairline, otherwise it gives the appearance of having a hairpiece or a toupee, and that's not what we're going for. So the other thing that I like to let patients know is if they're indecisive about the hairline height, it's always a good idea to perhaps start a little bit higher. In the event that a patient wants to have a lower hairline, you can always go ahead and lower a hairline in a second procedure, but once you've gone ahead and transplanted somebody a little too low, there's no way to bring it back up. So Adam, look, I want you to go ahead and grab the mirror, take a look at the hairline. While this is my suggestion to you, ultimately, what matters most is how you feel about it. The other thing that you'll notice is that while we kept the hairline at what I think is a comfortable, modest height, instead of bringing it down too much, if we keep it at this height, we're also able to pack the grafts in a little bit tighter, which will increase the density that we're able to achieve.